Hello and welcome to the Community Voice. I'm Fara Sax. My guest today is Dr. Zevy Landman. He is affiliated with Florida Center for Allergy and Asthma Care with 20 locations serving you and the audience throughout the tri-state area. He is currently the vice president of the company, and Dr. Landman did his internship and residency in pediatrics at the former Miami Children's Hospital, with his fellowship for allergy and immunology at Yeshiva University. He is board certified in allergy and immunity, and he is the principal investigator in the Florida Center for Research Center. He is fluent in English and Spanish, and together today we are debunking the myths about allergy and asthma. Wow, what a resume, Dr. Landman.
Thank you for that.
Thank you so much for joining me today.
Sure.
How does it begin for you? How did this journey start? Did you wake up one morning and say, I want to be an immunologist, I want to be an allergist?
That's a good question. I was born in South America.
Yes.
I was a very allergic and asthmatic child. So I used to get treatments, very frequent. I used to go to the emergency room. I was hospitalized a couple of times for asthma. So I recalled, probably I was 8, 9, 10, I said, I'm going to become a doctor and probably an allergist so I can treat patients that they have the same condition that I do. So that's what's made me, become an allergy immunology.
And this is a family business now.
Yes.
Did your brother also have allergies and asthma?
No, my brother never had asthma or allergy, but he also wanted to be an allergist.
And so together, you took over the practice.
Yes.
And what is that like? You see so many different things going on with people. You're treating adults, you're treating children that have allergies. And why do people see an allergist?
First, most of the programs where we train are for kids and adults because allergy is not only for pediatric population or adults. So you have to understand and know that pediatric kids and adults, they have allergy and immunology problems. So we treat all kinds of conditions.
Absolutely. And what is that like, the difference from being with a child versus an adult?
I did my residency in pediatrics, so that tells you that probably, do I prefer kids than adults? Probably a little bit more. I enjoy playing with them.
But we're never going to say anything in public.
No, and they don't complain as much. But, for me, it's the same to treat an adult as a child.
So what does a pediatric allergist deal with on a day-to-day basis?
The cases that we usually see is eczema. We see food allergy. We see asthma. We see nasal or eye allergies. And occasionally we see some, immune conditions.
Is this coming from internally when one has a food allergy? Is it external forces of, pollen, mold? And
very good. Usually allergy, it's familiar, it's hereditary. If you have one parent with history of allergy, you have probably 20-25% that one of your child will get allergy. If it's two parents, usually the percentage goes up to 50%. So then we know that when we see a child and has symptoms or signs that they becoming allergic, we do the history, we ask the parents, and then we'll probably know that they're going to be allergic.
Is it something you can outgrow?
Very good question. Allergy, you can become less symptomatic. Your allergy antibodies with age, they said, usually decreases. It can be treated, it can be prevented, and there can be what we call desensitized. That's the only way that your allergies probably will outgrow, and that's what we call immunotherapy.
So what do you do during the immunotherapy?
We test the child or the adult, we find what they are allergic to, and then we start with the immunotherapy. It could be sublingual or it could be sub-Q.
So what is the difference?
One is the drops that we give in the mouth.
Is that a new thing?
No, that's something that is very, very old. The only problem that in this country is not FDA approved. So the extracts are not standardized, meaning that there is not a company that will send you or sell you the extracts to you. You make them yourself from an extract. So you have to know who makes the vial or the drops, and you have to be confident that whoever is, giving you those knows what they're doing.
And does each path, whether you do the sublingual or you do the shots, or is it the same result at the same time? Like, which works faster?
There is no time that one works faster than the other one. One, sublingual, they say that you can, we recommend you can get it at home. It's a daily drops, that you go up on the dose until you reach a maintenance dose. The time is probably the same. It's between 3 and 5 years on maintenance dose. The other ones that are sub-Q, it's also built up weekly, and then after 4-6 months, you get to the maintenance dose. That's the plateau, and then you take it for 3 years every month.
And it's very interesting because people want it quick. They want a quick fix, and allergies is not a quick fix.
Yes, allergy is not a quick fix. You have to find the triggers. Then you can do medications while you are taking the sublingual or the sub-Q immunotherapy. And eventually you're going to see the difference and feel the difference.
Do you have to retest as you go along?
Very good. We don't retest as you go along.
I'm doing good?
Yes,
am I a good student today?
Because parents will ask that.
Yeah.
If you see that the child or the adult is doing well, is getting better, with the immunotherapy, you don't retest. You just tell them you're going to take 3-4 years of, allergy immunotherapy maintenance. Once the treatment is done, you probably will be desensitized in 95% or even more.
It's very interesting. There is an ABC of asthma, something that can help children and their parents understand how asthma works in a very simple way. Perhaps you can tell us about asthma, breathing, controlling. What goes on?
Yeah, the ABC. Number one, you have to define what's asthma. Mm-hmm. Asthma, I don't know if you can see the graph. I don't need the graph anyway. The asthma is...
I hope not.
I hope not by now. Number one is a condition that is reversible, meaning that if you treat, you prevent the symptoms, most probably you're going to get up to what we call normal levels. Mm-hmm. Asthma is not curable so far. You can control the symptoms and you can have a normal life. What happens? You get bronchoconstriction of the airway, like a tube. If you don't treat that, then there is inflammation inside and there is secretion of mucus. So if that's the case, then you have to treat the constriction and also the inflammation. Number two, once you know what triggers, you go to the right path of the treatment. And that's what we call the ABC of asthma.
It's cool. And then you brought these little toys on the table. Perhaps you can share with our audience what they do and how important they are when really in a very critical situation.
Yes. These are a couple of devices.
I thought it was a Tic Tac, actually.
Tic-tac, yes, and I can tell you who made it or how they made this device. These are two different devices. These treats, this is adrenaline inside. These are auto-injectors, meaning that you don't have to draw the amount that you need for age or for weight of the adrenaline. They already knows inside here how much you need it.
So this is an epinephrine?
Yes, this is epinephrine, and this is what we call auto-injectors, two different ones. They are extremely simple to use. You just take the cap, and then you just press in the muscle. Even if you have, your shirt or your pants, you just press it. You count 10 seconds, and the medication is given.
Why would one person want to? Why do we need to take epinephrine? Why? What would be going on that we knew?
If you have history of having a systemic or anaphylactic reaction to anything.
So anaphylactic meaning you can't breathe.
Yes,
you feel like a constriction or closure
of your airway.
The throat.
You start coughing, you start wheezing, you can faint, you get swelling of the eyes or the lips, you get hives in the body, and you know that's something that you're having a bad reaction. So that's when you have to use it. As soon as you use it, you or whoever is next to you needs to call, emergency 911. Because that's the protocol, and they will take you to the emergency, and you will get the appropriate care.
And the next one?
The next one is another device that it was made by somebody. There were two brothers. One was the technician, and the other one was the one who had the anaphylactic reaction. And this is like, is a newer device. You take the cap, and it tells you what to do.
Put it.
but
it talks to you.
No.
You are ready to use pull off red safety guard.
And then you pull this safety guard.
To inject, place black end against outer thigh. Then press firmly and 5, 4, 3, 2, 1. Injection complete.
Wow.
It's amazing.
This trainer may be reused for training.
She's going to talk.
A trainer, so I didn't get.
I was concerned she was going to talk the next 20 minutes.
No, because everybody knows that after you use it, you have to someone next to you needs to call 911.
Right. So.
And gray outer case.
Okay.
So if this were to happen, you would take. Oh boy, we might have to take her out of the studio. Let's take her out of the studio.
He's not trying to get in. Here.
This is called live theater, so you can take her outside. Thank you, Francesca.
That was a good one.
So if one has bug bite, if you're in the desert somewhere, let's just say, or you're, God forbid, you're allergic to peanuts,
to food, or you're allergic to a medication, or you have also what they know idiopathic unknown anaphylaxis that is hard to find the cause, and you start having the symptoms. The faster you use it, the better outcome. Don't hesitate to use it if you think you need it.
So it's prescribed by one of your
yes, it's
doctors?
Prescribed by one of the specialists, the physicians. We train the parent or the patient how and when to use it and what to do.
So it might be something good to carry if you're in a
you have to carry
all the time.
If you have that condition, you should carry an EpiPen everywhere.
Because you never know, and then call 911.
Yes,
absolutely. Also, there is pediatric asthma, and there's also adult asthma. Yes. What is the difference,
you can have asthma any time of your life. You can have pediatric asthma that starts early in infant, or you can develop asthma as an adult. The triggers or the mechanism is usually the same. So you're going to treat or in the pediatric population or in the adult population with medications appropriate for the age.
Absolutely. And this one really resonated with me when you have strong emotions. Strong emotions. Now, I'm not talking about anger here.
Happy emotions.
That's what I'm saying. You're laughing so hard, it triggers out. This is a big thing for me because what happens, I start scratching the back of underneath my chin, and then I feel like the whole body is my lungs are tingling. What is that?
And that triggered what?
It triggered a full-out blown asthma attack.
Secretes, what we call the mediators of the allergy pathway, histamine or other mediators, and then like laughing causes constriction of the smooth muscle of the airway. And then it closes and you wheeze. So you get the cough and the tightness.
So the cure is I shouldn't be laughing too hard.
Keep laughing. Because you're going to be controlled with your asthma with the medications.
Absolutely. And we have a question here from our audience. They're in Aventura, Bob from Aventura. What and how are eczema, food allergies, and nasal allergies, how are they all related? That's a good question.
Very good question. Eczema is, the skin. I tell that is, or parents or that it's an allergy in the skin. So if we have an allergy in the skin and we know that is triggered by aeroallergens that causes the nasal symptoms or the eye symptoms, or food makes it worse, then the three of them are, combined and it's in the same group. So we know what triggers the eczema, what you eat or what you touch or what is in the environment, then at the same time you are preventing the allergy to the food, avoiding it, and your nasal symptoms.
But can you, if you're on some kind of protocol with either injections or the sublinguals, can you have those foods that you're talking about, or do you stay away? Is it like
usually, if for the food allergy, we tell them that most of the foods, when you grow, you're going to be able to eat it again. If somebody is truly allergic to a food, causing a systemic reaction, hives, or making the eczema worse, I tell them avoid them. And every year I retest them until eventually they become non-allergic to those foods. There is two family of foods that they say we don't know why. Once you're allergic, it's allergic forever. The nuts and the seafood. If you had an allergy reaction or you were proof allergic to those, we tell them don't eat them. Now there are newer medications coming to the market that can make you become tolerant to those foods if you ingest the food by mistake. In other words, You won't have the systemic reaction or anaphylaxis.
What is it like? Just neutralize it?
You can say it's neutralized or makes you tolerant to the food. Not desensitize you, but makes you tolerant. You won't have a systemic reaction if by mistake you eat it.
And I know there were some studies that came out in Israel when the kids are eating this peanut candy, this bamba, because it has peanuts, and there are less allergies and asthma reaction in Israel.
That's a good question. Yes, they said that in Israel there is less because they introduce those foods early in life to the kids.
Right.
And they've proved, and there are studies showing that if you are exposed or they reintroduce to you early in life, the early the better, you produce antibodies to the antibody that is causing the reaction. So eventually you won't become allergic to those. Same with animal dander or dust mite. They said if you live since you are born in a house with pets or dust, your body produces antibodies and you don't have symptoms. But if you already have symptoms, then don't tell them, keep eating, that your body is going to get, desensitized or tolerance to that, or keep having the animal in the house or the dust in the house.
Very interesting. Very, very interesting. Another question here. This is from Joyce, and she's in Plantation. We suspected that my son was having allergic reactions to milk. We took him to a pediatrician, and we did blood work. And it turns out now that he is allergic to everything. If I go to the allergist, do I have to have him tested again? And he is terrified of needles. I understand, Joyce. We all do.
Yes, we all do, and I understand them. Number one, before being afraid or not afraid, there are ways to numb your skin so you don't feel the needle. Number two, if we do food testing, we don't do needles. We do something that is called prick or scratches. I should have brought, the device to show you. And it's a very common, I don't know if it's a mistake or overuse of the labs when you suspect that you have food allergies. Because I would say a very high majority will show that they are allergic. And that's what we call false positive results, meaning that the kid is eating those foods, but when you do the blood test, it shows positive. And then the pediatrician or the primary or the family or the parent or the mom doesn't know what to do. And that's why when we see them. So we do the history, very important. Do you eat all of the other foods that you were positive? Yes. We only do allergy testing to what we suspect was a true allergic reaction to the food.
So in other words, you can test positive and not be allergic.
Yes.
So that's really a hard determination to make.
Yes, that's what we call false positive. And with food, is higher than if when we do to the environment or like pet animals, that if you have a positive results, you are allergic. If you have a negative result in the skin testing, you are negative. With food is different. We get a lot of false positive. If the kid eats those foods, has been eating those foods, even if the testing is positive, eat them. If the kid had an allergic reaction, swelling, bloody stools, hives, cough, eczema, then we suspect a true allergy. Needs to be seen by an allergist to rule out and to tell the parents what to do.
Absolutely.
Once, if I can interrupt.
Sure.
If they are allergic, let's say to dairy, and we prove it, we tell them, don't have any dairy products for a year. We retest them. If that's still positive, we retest them in a year after. Usually between 4 and 6 years old, they become desensitized by their own. We do testing negative, and then we do the oral challenge. That is the goal of how we treat and tell the parents that they can eat dairy. So
regarding dairy, what is it that most people are allergic to in the dairy
Usually
itself?
You're allergic to protein. Every food or every air allergen has a protein, more than one protein, and you're usually allergic to 1 or 2 protein. So in the dairy, you can be allergic mainly to the casein, that is a protein in the dairy, or also the lacto, that is another protein that you have in the dairy. Like a mistake, parents said, if they're allergic to dairy, I'm gonna give a lactate-free milk. That's wrong, because it has more protein. And if you have more protein, you're gonna be allergic too. So don't do that.
So it's a catch-22, and you have to know the right balance.
Yes,
By contacting you at Florida Center,
Yes.
and that's very, very important.
And another mistake that,
Don't self-diagnose.
don't self-diagnose, yes. And another big mistake that I'm seeing now having grandchildren, that the mothers of my daughter asked me, that they told that if you give small amounts of, let's say, of dairy, even if they had a true allergic reaction, nothing is going to happen to the child. Be careful.
So don't do it.
No.
Stay away.
Yes.
And what about dairy-free or,
Dairy-free is dairy-free. If you are sure that it's a dairy-free and you read the labels, there's no problem. There is no dairy or dairy proteins in the product.
Good. Joyce. No, I'm sorry. This is Tony from Kendall. My daughter is having allergic reactions to our stray cat. There we go with that poor little cat again. But my grandma told me to follow her home remedy is to keep little kitty at home, and the more she plays with the cat, the more she'll get used to it.
She has part of the question right.
Which part, though?
The part that if you have the cat early in life without having symptoms, you won't become allergic to the cat, like I told you before. But this child already is having severe symptoms. So if you keep the cat in the house having the symptoms, you're doing nothing. So the child is going to have more and more, symptoms around the cat. The cat allergy is in the saliva, in the urine, and in the skin. The skin dander of the cat is very light, so it's in the air everywhere in the house. Doesn't matter where the cat walks or stays. If you get rid of the cat, it will stay in the house 6 months to a year after you get rid.
Wow.
Because it's in the air. Now, there are ways to decrease allergies to the cat in the house, washing the cat every few weeks. There is certain solutions that you can put or powders in the cat. Don't let the cat in the house. But the best is, or you get rid of the cat, or you give allergy immunotherapy to the cat to desensitize.
That is wonderful. That is wonderful. Here's another question. This is Gloria from Aventura. I know that there are allergy drops, which we talked about, that are immunotherapy treatments for allergies. Are they available for children?
Yes. Allergy immunotherapy, as I told you before, sublingual or FDA approved that are the sub-Q, are available for children all ages.
And you do them at the Florida Center for Allergy and Asthma
we
Care.
recommend them to be given in the office because we recommend it by the recommendation of the academy that they need to stay half an hour to see if there is no reaction for the immunotherapy.
How old are the children, the youngest that you can treat?
We usually start at 4 to 5 years old. Maybe younger if they are not well controlled or they are getting worse. But that's the age that we usually start immunotherapy.
And you've been at this a long time. So what changes have you seen from when you first started practicing to now in the system of medicine? How far has it come?
A lot of changes, especially in the immunology part.
What was the biggest for you?
For me is now the biologics or immunotherapy for certain allergic and immunological conditions. Same immunotherapy that there is now available for cancer, we use it for allergy immunology.
What? Tell me a little bit more about that. Tell our audience.
Those are blockage medications that when you give, let's say that somebody comes to your office with urticaria, hives, unknown cause, we've done everything, we've given all kind of medication, the patient still coming with the hives and is getting worse. There is now immunotherapy called biologics that blocks specific what causes the condition, and when they get it, they get much, much better. It's amazing, the results. We have the same for eczema, for severe eczema, for kids 6 months and older. And you can see kids or adults before, during the medication, that they get completely clear of the symptoms.
And that really speaks to what goes on in the psyche, because if you're feeling better, you're feeling better about your life, you're happier.
Yes.
When you're feeling miserable with any kind of allergy or asthma symptoms, it's very self-limiting. If you have asthma, you might not want to go for that walk, that run. You might want to step back from that. And if you have allergies, and the next question is also about that, is there such a thing as the allergy to March? And you might not want to go outside and garden and be out in nature.
Now, everybody thinks that the allergy to March is the allergy that we have pollen here in March. The allergy to March is what they said, how the allergy progresses in life. So it's not the same as what most of people think. We have allergy in March, the pollen is high in March, so your symptoms of asthma and allergy is going to get better. But usually what they mean is how it progresses during life. You start with the eczema as an infant, then you get the food allergy, then you produce antibodies to the environment, you get the allergy symptoms, the eyes, the nose early in childhood, and eventually if you don't get treated, you get asthma symptoms too. And that's what we call the allergy march, because you're marching.
At least you're out there with the fresh air in March, right?
Yes.
And getting allergy symptoms.
But let's see, if you are allergic to pollen, what we recommend, if you can stay indoors, you do your activity indoors or your exercise indoors, you won't be exposed as much to the pollen, so your symptoms are going to get controlled.
Is there certain times of the day that are better for less pollen and less mold mildew in the air?
Usually, if it's at the time of the pollen, if it's not raining, usually the whole day here in Florida, you're going to have the pollen.
So when it's raining, tell me about what happens.
Usually when it rains, the pollen drops to the floor.
So you're better after that to go out?
Yes, or during. You're going to get wet.
There's songs about walking in the rain.
Yes,
so okay,
fun.
So you probably wrote the song, Allergy and Immunology. That's who wrote it. Interesting. That's a wonderful.
Very, very interesting. Yes.
So it's the march of the season. It's really just the allergic march of what your allergy progression is.
Yes, and what you can do during that march to prevent the progression.
And then, is the first precursor or the first notice is eczema?
No, could be breathing issues before the eczema, but that's what they say. That's what most of the people will get it. And then, if you have an infant that has the eczema, then you know that child is probably going to be allergic. It's going to become allergic to food. It's going to have allergic symptoms of the nose, the eyes, and allergic asthma. 60 or 70% of asthma is allergic. So allergies, that's what we treat. So we find what triggers and what causes those asthma symptoms, those allergy symptoms, then the patient is going to do much better.
And if you move, and if you're moving from, let's say, from here to another city, another part of the world, as allergies change as you move into those other new locations?
Yes, it changes because the pollen in different locations are different. The year-round allergens like the dust mite or animal dander is going to be here or in another part of the world. But the pollen and the mold, it changes, depends where you move. So if you are not better after you're moving to a different location, you need to be tested in that location to those particular pollen.
There's another question here, another one from Kendall. Her name is Audrey. Are there any apps that can help with keeping tabs on food allergies? Thank you for that question.
I answer like anybody else would answer. There are many, many applications. Google them or go to Apple Store. You put what you want or what you are looking for, and then you're going to get the free apps applications.
Well, you just became a salesperson for all the apps.
For all the apps. And that's what I do. When I need, to do an application, and that's what I do. And I go in.
And talk about the research part of what you're doing. And do you work with children on that research center?
Yes, we have a research center, and we work with different pharmaceuticals on what we know and what we do. Food allergy, asthma, we do medications, things like that. So we have all kind of researches in our practice.
And people can come and give you a call.
They can call, they can come, and if they are appropriate for the study, we are going to enroll them in the study, and they're going to get everything.
And the time we have left, tell me something wonderful, a story perhaps that you're able to change someone's life that had been suffering with allergy and asthma. Look how fast that came to you right away.
Because I just saw that personally, a few weeks ago, was a teenager, severe asthma for years. She used to come to the office with the face covered, with hat, with eyeglasses, with long sleeves and long pants. She was probably, when I met the patient, 11, 12, 13. So I put them on one of these new biologics. Now you should see that child. She's probably 16, 17, Every time she comes, she hugs me. She comes always with the father. And it's changing her life. She's much, much, much happy.
So she doesn't wear the hat and the...
Nothing. She comes in shorts.
Wow. You really changed her life.
Me and the medication, yes.
Absolutely.
And the new medication. So there are now hopes for many, many things.
Well, what's wonderful. Dr. Zevy Landman, thank you so much for being my guest today. And if you have any questions and you want to have more information, it's www.florida-allergy.com. It's on the bottom of the screen. And thank you so much.
I will answer everything, yes.
Thank you so much. And how many doctors?
Many, like 12, 13 doctors in the practice.
And how many locations?
19 or 20 locations, yes.
Wow, and still growing. And,
yes,
and thank you so much.
My pleasure.
And when I first had my allergies, that was the place I went to get better, and they got me better. So thank you for the practice.
Thank you very much.
And thank you for your time today.
Thank you.
And I want to thank you for joining me today. I'm Fara Sax. Until next time, take care of yourselves and each other. Have a great